Pamela Hunter, and this is my video for checkoff for IV push medications. I have an order for my IV push medication. Order is for Lasix 30 milligram IV push every 6 hours. The first thing I'm going to do is pull the physician's order and compare it with my MAR. First, I'm going to check the patient name. Then I'm going to check that it is the right medication, Lasix, the names match for the medication and for the patient. 30 milligrams is the right dose. IV push is the right route for both, and every 6 hours, so my MAR is correct, it matches the physician's order. I'm also now going to go ahead and pull my medication, Lasix or furosemide, which is the same thing. You can see the vial here. I'm making sure that I'm giving the right medication, and so I have that, and I'm going to set it aside here. While we're looking at the chart, we're also going to look at any allergies which my patient does not have. We've gone to the book and we've already done this, but I'll briefly go over this, that we have verified that this is the Lasix at 30 milligrams is a safe dose according to the book. We have looked at, for dilution, we're giving this medication undiluted. The rate of administration is going to be over 1 to 2 minutes, so that's how long we'll give the medication. We have to verify that this medication is compatible or not with the fluids that are infusing currently. The patient is now on normal saline, and that is compatible with furosemide. And so we've taken care of all those checks. We would look for any contraindications or any pertinent labs that we need to review. Because Lasix is a strong diuretic, I'm going to go ahead and be monitoring my patient's blood pressure, and I'm going to be looking at their BUN and creatinine and all of their electrolytes to make sure that they're not low. I've already checked those and everything is within normal range. We now have the medication. We're going to go ahead and collect all the supplies that I'm going to need. I'm going to need a syringe, the medication, a label, the MAR, and some alcohol wipes. Okay, so we have those. Now that we have everything situated, I'm going to go ahead and perform hand hygiene. I'm going to look at this vial. I'm going to do my math at this point, but I've already done it. I'm just telling you that I would have looked at this vial. I know I'm giving 30 milligrams, and this vial says there's 10 milligrams in 1 milliliter. So with my math having been done, I know that I'm going to give 3 milliliters from this vial. I'm going to give it undiluted, and I'm going to administer the medication over 1 to 2 minutes. So we're going to go ahead now and clean this. About 30 seconds. That's done. Let it dry. While it's drying, I'm going to go ahead and fill out my syringe medication form. I'm going to put Lasix, furosemide. I'm going to do 3 milliliters, today's date and time, the patient's name, and my initials because I'm the one that's preparing it. Okay? So I'm going to put that on the syringe when after we've drawn up the medication. So we now have our syringe. It is important that you know that I selected a 3 milliliter syringe because the patient's going to be receiving 3 milliliters. We choose a syringe closest to the amount that we're administering. So the 5 milliliter and the 10 milliliter syringe would have been too large and kind of not been as accurate. So we're going to be using the 3 milliliter syringe. I've cleaned the top. I've given it a chance to dry. So we're going to go ahead and draw up the medication. I'm instilling 3 milliliters of air. And then I'm going to drop 3 milliliters of the furosemide. So I'm showing you that I have 3 milliliters. Okay. I'm going to go ahead. I'm going to label that. We now have our medication label, 3 milliliters. I have the MAR, and I have alcohol wipe, and so we'll clean this up, clean our area, and we are going to head in to see the patient. Upon entering, I'm going to introduce myself. Hi, I'm Hannah. I'm your nurse today, and the doctor has ordered Lasix for you. It is going to be given through your IV, and it's going to help with some of the swelling and edema you have been experiencing to draw some of that fluid off, okay? I'm going to check their ID band. It matches the name on the MAR. I'm going to ask the patient to give me their name and date of birth. They've done so. I have had 2 patient identifiers at this point. Okay. I'm going to ask the patient again about any allergies the second time. The patient denies having any allergies. So we're ready to go ahead and get started. I'm going to go ahead and do hand hygiene again. And I'm going to go ahead and put on a pair of gloves because I'm going to be assessing the IV site. Gloves are required only when you are doing it into an INT, but I'm going to go ahead and wear them anyway. I am going to ask the patient as I'm looking and if they're experiencing any pain or discomfort. I'm looking for any signs of swelling, redness. I see none of that. The patient denies any pain or discomfort around the IV site. I see that the fluid is infusing, and I'm going to go ahead and drop this down to look for a little blood return. I get that, and we're going to go ahead and put it back up. So we now can say that the IV is patent and medications are infusing through it just fine. With that having been done, or fluids are infusing through it just fine. With that having been done, we're now going to select the port that we will be using. And my gloves have something super sticky on them, so I'm just going to get rid of that one. I'm going to go ahead and select my port at this time. With IV push medications, you're going to select the port closest to the patient. So here is my patient, and here is the first port that you come to. I'm going to clean that. 30 seconds, get it really clean. Okay. 30 seconds, and it's done. I'm now going to do my third check with my medication. As I said, I've checked the name on the band, name on the MAR matches. I'm going to again look at the right medication, right dose, right route, right time. At the right person, we are ready to administer this medication. I did ask the patient again about allergies, and they denied any. Okay. So I'm going to go ahead and attach this and distill to the patient. I have my patient, my port, and then on the other side, I have pinch. This is the side that's going toward the patient. So I have my IV, my port, and then I pinch. I'm going to take my watch, and I'm going to look at this medication, and I have 3 milliliters to give over 1 to 2 minutes. So I'm going to give about 1 milliliter every 45 seconds. So I give the first, using the push-pause technique. I stop. I wait 45 seconds. I go ahead, 45 seconds have passed, let's say. I give another push. And I wait another 45 seconds. 45 seconds have passed. I push in the last milliliter. I can now release because I don't need to flush with normal saline or compatible fluid because the furosemide is compatible with what is already infusing. So I can release, take this, and all this, dispose of it appropriately in the sharps container. At this point, I'm going to, again, assess my patient's IV site. Looks good, no signs of infiltration. A patient denies any pain or discomfort when I ask them. I look, this is still infusing at the right rate, and so at this point, we're going to make sure the patient is in a position of comfort, bed low, call light within reach, side rails up, and I am going to make sure that everything has been cleaned up, everything properly disposed of. Take the MAR, and I'm going to head back to the nurse's station and chart.